Spinal nerves 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, 1 coccygeal have 31 pair of spinal nerves enclosed by meninges مغطى بغشاء السحايا. Between the vertebral canal and the dura mater there is an epidural space. It has a shape لكن الجري والوايت matter معكوسات مع central nervous system. The gray matter it's the center while the white matter is the outer or the surrounding الخارجية. Peripheral nervous system there are 12 pairs of special nerves called cranial nerves which emerge within the skull or cranium. The peripheral nerves 31 pairs of nerves attached to the spinal cord, as we said, 8 from cervical, 8 thoracic, 5 lumbar, 5 sacral, 1 coccygeal. Each nerve has an كل عصب له anterior part بنسميه ventral ويحتوي على root containing motor fibers وأيضا يحتوي على posterior يسمى بالdorsal root containing sensory fibers. The anterior and posterior root merge to form a short spinal nerve less than 5 mm. These peripheral nerves contain both sensory afferent وmotor efferent fibers. This picture clarifies the 12 cranial nerves. المطلوب منكم مراجعة لشابتر الفيزيكال اكزام كما أخذناه في شابتر الفيزيكال اكزام. نعرف اسم الكرينيال نيرف. راح نعطي أكثر من مثال من هاي السلايد لكن مش كلها. اسم cranial nerve number 1 اسمه olfactory, type sensory, function smell. How you can test كيف تفحصه بدكم تجيبوه من كتاب الفيزيكال اكزام. مثال ثاني number 3 اسمه oculomotor, نوعه type motor, function muscle that move the eye and lid, pupillary constriction and lenses accommodation. How we can test طبعا كنا نفحصه بعدة طرق مثلا الاتشيب حركة الاتشيب بالإضافة إنه يعمل focus on near and far object. مثال آخر number 5 V اسمه trigeminal. هذا mixed. شو يعني mixed؟ both sensory and motor. الفانكشن facial sensation, corneal reflexes, mastication. How we can test? You have to go back to read how we can test this nerve. Another nerve is number 11 X1 called spinal accessory. It's a motor. Function sternomastoid and trapezius muscle. How we can test? Number 12 X22 motor, movement of the tongue. How we can test? All of these things your responsibility to go back and to read. كل التست كل النيرفز الموجودات في السلايد هاي مطلوبات. The central nervous system under physical or emotional stress, fight or flight بحدث تغيير the sympathetic and the parasympathetic. Regarding the sympathetic, mediated by norepinephrine NE اختصار لnorepinephrine أو ما يسمى بالadrenergic nervous system. The neurons located in the thoracic T1 to lumbar L2 segment عشان هيك يسمى thoracolumbar لأنه يقع ما بين T1 L2. Action bronchioles dilation for easier gas exchange, increase heart rate and blood pressure during the stress during fight, coronary artery dilation, peripheral blood vessels dilation constrict, the skin is cool, pupil dilated, liver release glucose for energy لأنه في عندنا هون stress في ركض في مشي في خوف, peristalsis decrease, respiratory rate increase. العكس موجود كمان شوي في الباراسمباثيك. parasympathetic non-stressful situation، لأن كيف بدنا نرجع الجسم للوضع الطبيعي. This parasympathetic mediated by acetylcholine وما يسمى بالcholinergic nervous system. The fiber located in two segments in the brainstem and from L2 and below، عشان هيك بنسميهم craniosacral. cranial من cranium في البرينستم، وساكرال لأنه شو تحت L2 sacral. Regarding the assessment, we have to start with the history, complete his history, chief complaint, past health history, family history, personal history, and review of body system.